Heartworm disease in dogs. Causes, symptoms, treatment, and prevention. Introduction. Heartworm disease is a serious and potentially fatal condition that affects dogs, cats, and other animals. It is caused by the parasitic worm Dirofilaria ammitis, which is transmitted through mosquito bites. The disease primarily affects the heart, lungs, and blood vessels of infected animals, leading to severe health complications if left untreated. This article explores the causes, symptoms, diagnosis, treatment, and prevention of heartworm disease in dogs, emphasizing the importance of early detection and preventive measures. What is heartworm disease? Heartworm disease is a parasitic infection in which worms grow and reproduce within a dog's cardiovascular system. The adult worms can reach up to 12 inches in length and primarily reside in the pulmonary arteries and the right side of the heart. As the worms multiply, they cause inflammation, blockages, and damage to the heart and lungs, leading to life-threatening complications. Causes and transmission. Heartworm disease is spread through mosquito bites. When a mosquito bites an infected animal, it ingests microscopic heartworm larvae called microfilariae. These larvae mature inside the mosquito over a period of 10 to 14 days. When the infected mosquito bites another dog, it transmits the larvae into the dog's bloodstream, where they develop into adult worms over the next 6 months. Certain factors increase the risk of heartworm infection, including 1. Geographic location. Heartworm disease is more prevalent in warm, humid regions where mosquitoes thrive, such as the southeastern United States. 2. Outdoor exposure. Dogs that spend a lot of time outdoors are at higher risk. 3. Lack of preventive medication. Dogs not receiving regular heartworm prevention are highly susceptible to infection. Symptoms of heartworm disease. The symptoms of heartworm disease vary depending on the severity of the infection and the number of worms present in the dog's system. The disease progresses through 4 stages. Stage 1. Mild infection. 1. No noticeable symptoms or only a mild cough. 2. Slight lethargy. Stage 2. Moderate infection. 1. Persistent cough. 2. Fatigue after mild exercise. 3. Reduced appetite. 4. Mild weight loss. Stage 3. Severe infection. 1. Difficulty breathing. 2. Severe fatigue after minimal activity. 3. Frequent coughing, sometimes with blood. 4. Swollen abdomen due to fluid accumulation. Stage 4. Caval syndrome, life-threatening stage. 1. Blockage of blood flow due to large numbers of worms. 2. Severe cardiovascular distress. 3. Sudden collapse. 4. Pale gums and dark-colored urine. 5. Death can occur if emergency surgery is not performed. Diagnosis of heartworm disease. Veterinarians diagnose heartworm disease through several methods. 1. Blood tests. The most common test is the antigen test, which detects proteins released by adult female heartworms. A microfilaria test may also be performed to check for immature heartworms in the bloodstream. 2. X-rays and ultrasound. Chest X-rays help determine the extent of heart and lung damage. An ultrasound of the heart, echocardiogram, may be used to assess heart function and detect the presence of worms. 3. Additional diagnostic tests. A complete blood count, CBC, and chemistry panel may be conducted to evaluate organ function and detect signs of inflammation. Treatment of heartworm disease. Treating heartworm disease is a lengthy and costly process that involves eliminating adult worms and microfilariae while minimizing damage to the heart and lungs. The treatment protocol includes 1. Stabilization. 1. If a dog is severely ill, the veterinarian may first stabilize it with medications to reduce inflammation and heart strain. 2. Adulticide therapy. 1. The primary treatment involves a series of injections with melarsamine, a drug that kills adult heartworms. 2. This treatment is administered in multiple doses over a period of months to minimize complications. 3. Microfilaria treatment. 1. After adult worms are eliminated, a separate medication is given to kill the remaining microfilariae. 4. Exercise restriction. 1. Dogs undergoing treatment must have limited physical activity to prevent complications such as embolism, worm fragments blocking blood vessels. 5. Follow-up testing. 1. After completing treatment, the dog is retested for heartworms to ensure all parasites have been eliminated. Prevention of heartworm disease. Preventing heartworm disease is much easier and more cost-effective than treating an infection. There are several highly effective preventive measures. 1. Monthly preventive medications. 1. Oral tablets, e.g., Heartguard, Sentinel, Interceptor. 2. Topical treatments, e.g., Revolution, Advantage Multi. 3. Injectable preventatives, e.g., ProHeart 6 or ProHeart 12, which provide protection for 6 to 12 months. 2. Mosquito control. 1. Reduce standing water in yards to minimize mosquito breeding. 2. Keep dogs indoors during peak mosquito activity, dawn and dusk. 3. Use dog-safe mosquito repellents when necessary. 3. Annual heartworm testing. 1. Even if a dog is on preventive medication, annual heartworm tests are recommended to ensure protection. Heartworm disease in cats and other animals. While dogs are the primary host for heartworms, cats and other animals can also be affected. In cats, heartworm disease manifests differently, often causing respiratory issues rather than heart failure. Unfortunately, there is no approved treatment for heartworms in cats, making prevention even more critical. Conclusion: heartworm disease is a serious and potentially deadly condition, but it is also one of the most preventable. Pet owners should prioritize year-round heartworm prevention, regular veterinary checkups, and mosquito control measures to protect their dogs from this dangerous disease. By staying informed and proactive, dog owners can ensure their pets live long, healthy, and heartworm-free lives.